guys. Senior Citizen's Parenting Group.
Nice to see you.
Nice to see you. Boy, he's getting big, huh?
Yeah, he is.
What are you up to?
We just came from his pediatrician visit, and we learned a lot about dental health.
Hello, my name is Ben Danielson. I'm a pediatrician here at Odessa Brown Children's Clinic, a part of Children's Hospital in Seattle. I think a lot of parents don't always realize how important it is to have good oral health. Dental disease in infants causes significant pain, and they might not be able to tell you as a parent how much pain they're in. In addition, it can affect so many elements of quality of life, you know, like sleep and playfulness and even the ability to develop good language skills. Dental disease is the #1 chronic illness of children.
What'd you learn?
Well, did you know that they can get their first dental screening from either the pediatrician or a dentist by the age of 1?
How are you?
Good, how are you doing?
Can I come in?
Yes.
Yeah, is it time for checkup, young lady?
It is a time for checkup.
Oh, it's already a year. One of the first things to think about is making sure that your baby has their first screen by a doctor or a dentist by their first year of life. Make sure that your doctor is really talking to you about oral health.
Well, he's just getting so many teeth now, so we were just wondering a little bit about dental care. What causes cavities?
He inherits normal bacteria, mostly from you actually, and they live in his mouth and help him digest food, but they also... Some of those bacteria, though, do tend to break down enamel and start leading to the development of cavities.
And they can get cavities on their baby teeth?
Oh, yeah, yeah. Baby teeth are really important. They're not just placeholders for future permanent teeth. For baby's first teeth, one source of potential cavities is in practices around bottle feeding and nursing. Some babies will fall asleep with a fair amount of milk in their mouths, and that will be a continuous exposure of sugar to those teeth. Milk pooling in his mouth when he's sleeping actually is a good way to get cavities. We talk about things like substituting a bottle of water, perhaps, instead of milk, if a child really uses a bottle to fall asleep at night.
How they eat can affect their dental health and whether they get cavities and all of that.
I was wondering about nutrition and what types of foods you would recommend in order to prevent cavities.
We talk about what kinds of healthy eating habits contribute to healthy mouths. Do you know about how much sort of hidden sugar is in starchy foods?
I don't. Because she does like cereal.
She likes cereal. Things like crackers and chips.
Amy loves those cereals too.
If you're using those as a big part of a child's snack or mealtime nutrition, then you may be exposing them to risk for cavities without really realizing it. Sometimes there can be fruits and vegetables that you can substitute very easily for those crackers. The same things that I'm talking to a family about regarding healthy nutrition, healthy foods, avoiding some of the unhealthy foods. Those unhealthy foods are the same ones that contribute to this great obesity epidemic that we're facing today. Juice is that hidden calorie, hidden sugar source that can really affect a child a lot. And if they are going to have their children eat lots of sugary snacks, or if they are going to eat even snacks containing carbohydrates, then it's probably a good idea to try to brush their teeth right afterwards. So healthy foods, better teeth, less obesity, happier kids.
They need to have their teeth brushed twice a day.
Twice a day.
Twice a day.
Gosh, I didn't know that.
Setting up a pattern that you're going to reinforce in your child and you're going to reinforce for yourself so that it will be something that happens every single day. You can use terry cloth or you can use a soft toothbrush, but it's important every day. Try to clean them.
Toothbrush cleaning.
They said the best thing is role modeling good dental care yourself, like brushing your teeth and flossing and going to the dentist.
So I wanted to ask you about your own oral health. Have you had a lot of cavities? Talking to a mom, and she has had cavities recently, especially within the last year. Her baby is going to be at higher risk for cavities. It gives me a chance to tell her that it's especially important for her to be very careful about promoting good oral health in her baby.
Really brushing? You get all the way back.
This is important for a couple of reasons. One is a mom treats her oral disease effectively, then she really decreases the risk that she's going to pass that on to one of her children. The second thing is that when a child sees a parent brushing their teeth every day, a child is more likely to brush every day. When a child knows that a parent goes to a dentist regularly, a child goes to the dentist more easily. When a child knows that a parent expects them to brush their teeth every single day as part of their routine, then there's less fighting over that particular issue. So I'd like to take a look, if I may. We'll talk a little bit about what I'm looking at, and then make an assessment of whether or not you need to get to a dentist, or looking at a child's gums. Ooh, no plaque really down low. Looking for signs of swelling or redness. Looking at the teeth really carefully. I'm going to try to look even behind the teeth. This is at home too. Just lift down the lip and look at the under the lip. And lift up the upper lip and look under there. Oh, and I do see just a small spot of white on the upper tooth here, especially at the place where the teeth meet the gums. And if there are signs of white spots or brown spots or discoloration of any kind, to come in right away and get checked out.
And they can get fluoride varnish from the pediatrician as well. What is fluoride varnish?
A little sticky paste. You can treat early signs of disease with fluoride varnish that can be applied in your doctor's clinic or in the dental clinic. This varnish helps prevent the progression of disease and may help reverse some of the early cavities themselves.
Good.
Thank you. Good job, Taj.
Barriers to healthcare, including issues of eligibility and insurance, should not keep you from getting your child into a dentist when they need to be seen. You can call your local health department, and wherever you are in Washington State, they can help you find a resource when you need it.
He doesn't have a dentist, and we have coupons.
You can talk to the health department. They can give you probably a list of referrals, but there's a program called ABCD, which links you to a dentist in your area.
So brush kids' teeth twice a day, and they can get a fluoride varnish from the pediatrician or dentist from 12 months on up.
Yeah.
I didn't know. No, we were thinking about all the other issues, but this makes a lot of sense. You know what? Maybe you can share this like in our parenting group.
Yeah.
You know, that's good information.
That is, yep.
Well, that's nice. Well, listen, I have to run, but it was nice seeing you
Nice
guys.
seeing you.
First screen by first birthday. Brush your child's teeth twice a day. Ask your doctor or dentist about fluoride varnish. Choose healthy snacks and food. Model good oral hygiene for your child. It's really about developing healthy teeth from the beginning. They're going to help them have healthy teeth for a lifetime. Just remember, we're not healthy unless our mouths are healthy.